indwelling catheter. So the equipment that we need to use is or the syringe, the same size and as type volume solution, or 10 cc, and then next is the waterproof pad, the specimen sterile container, labeled correctly, our 25 gauge and 1/2 needle, our alcohol swab, and non-sterile gloves. And then the goal of this procedure is the catheter is removed without difficulty and with minimal patient discomfort. And physician's order and note the period of time catheter was in place. And then next is our planning. So we need to place the necessary materials and supplies into our patient's bed or our patient's table. And then we need to close the curtains around the bed and close the door to provide privacy. And then we need to discuss the procedure to our patient. So I will be removing your catheter. And then next, as I am Michelle Cruz, your nurse for today, and you are, we need to identify our client. So he is Mr. De La Cruz. And the next is we need to adjust our bed to comfortable working height, preferably usually about elbow height natin siya. And the next is we need to stand on the patient's right side if you are right-handed, and on the patient's left side if you are left-handed. Hala ka. Next is we will be washing our hands, and then we will be donning our gloves. And then, so I will be going here because our materials is here, but I am right-handed, so we should be in the right side of our patient. We will don now our gloves, and then we need to perform if bladder condition is to be performed, such as hours before the removal clamp of the indwelling catheter for 3 hours, or we need to remove the we need to clamp the indwelling catheter. Wait. Using a clamp or forceps. So again, I will still be using our tube, so I will just use a clamp. But you can use a forceps to clamp the tubing if bladder condition is present or to be performed. So we will be clamping it, our catheter. And then next is unclamp and drain the urine for 5 minutes. So first is we need to put our washcloth in our patient's between his thigh. And then next is unclamp and drain the urine for 5 minutes. And then next is we will now provide privacy, but we already provided privacy by closing the doors or the curtains. And then also, if we need to drape our patient, it is also it should be done, draping our patient. And then next is repeat clamping for 3 hours and draining for 5 minutes 2 more times. And then next is we need to position the patient in supine position. And then next step is we need to perform or place a waterproof, which we already did. We already put our waterproof pad. And then next is we need to obtain urine specimen if required. It's our container. So we will be obtaining a urine specimen. And then next is we need to remove the adhesive tape anchoring the tube or the catheter, and then cleanse any residue on the skin using our antiseptic swab. Or alcohol swab. now be we will now insert the hub of syringe um, into the bulb and then aspirate the entire amount of the fluid used to inflate the balloon. Okay, removing this, and then example we already we inflate, and then also we will aspirate, and then the next is we need to pull the catheter out. We need to pull the catheter out smoothly and slowly. Smoothly and slowly. Wait. And then next is we will now wrap the contaminated catheter in our waterproof pad, and then unhook the collection bag and the drainage from the tubing or from the bed. And then next is we will now reposition the patient, and also we will put the soiled catheter into the trash bin, and then reposition the patient as necessary, and then lower the level of the bed and position the child raise accordingly. And the next is we need to measure and empty the contents of the collection bag. So we will be putting the urine in our cup or our urine receptacle. Next is dispose all the contaminated supplies properly and wash our hands. And then our evaluation, we need to observe the time and the amount of first voided of our specimen, and note any discomfort experienced by the client when voiding, and condition of the skin from the adhesive tape. And then we also saw that the condition of the skin is normal. There is no irritation, or there is no redness in the skin. Yung documentation, we need to document the procedure, we need to document the type of the urine, the amount, and the viscosity of the urine. Thank you.